Radius bone is one of the long bone of upper limb. It is homologous to tibia of the lower limb. It is lateral bone of the forearm. So let's discuss the radius bone. Site determination of radius bone. Radius bone is divided into three parts: upper end, middle, also is known as the shaft, and the lower end. Upper end contains the head. This is the head, which is one is having radial tuberosity. On the shaft, this border is known as this medial border. It's sharpest in all three borders. That is the medial border. And lower end, this is the styloid process. This process is known as the styloid process, with directed downward and laterally. On medial part, having a notch, this is known as the ulnar notch. And on posterior surface, having a tubercle, and this tubercle is known as dorsal tubercle of Lister. Dorsal tubercle of Lister. So, according to these features, this radius is belong to left side. This radius is belong to left side. Now discuss the external features of radius. On the external features of radius, this radius is divided into three parts: upper end, middle, also known as the shaft, and the lower end. First, upper end. Upper end contains the head. This is the head. This part is known as the head, which is having concavity upward. Having concavity upward. This is the also circumflux of the head of radius. This is the neck of the radius. This part is the neck of radius, and this is the radial tuberosity. This part is known as the radial tuberosity. Now, shaft or middle part is having three borders and three surfaces. First, three borders. This is the medial border. It is the one of the sharpest border in all three. This is the anterior border. This border is the anterior border, having oblique line on upper part. Having oblique line on upper part. This is the anterior border. And behind, posterior border. It is the mirror image of anterior border, but it's more prominent on the middle one third of the shaft. This is the posterior border. Medial border, anterior border, and the posterior border. Now come to the three surfaces. First, anterior surface. This is the anterior surface, which are located or present in between the medial border and the anterior border. This is the anterior surface. This is the lateral surface. This surface is the lateral surface, which are present in between the anterior border and the posterior border. It is known as the lateral surface. And behind, it is the posterior surface, which are present in between the medial border and the posterior border, is known as the posterior surface. So three surfaces and three borders. Now lower end contain five surfaces. Lower end contain five surfaces. This is the anterior surface of the lower end. This is the anterior surface. This is the posterior surface. Posterior surface contain a tubercle, and this tubercle is known as the dorsal tubercle of Lister. This tubercle is known as dorsal tubercle of Lister. This is the medial surface. This medial surface is having a notch. That's why it is known as the ulnar notch, which attach with the head of ulna. So this is the ulnar notch, which is known as the medial surface. This is the lateral surface, and this lateral surface is known as the styloid process. The styloid process is project downward. The styloid process project downward. And inferior surface having two impression. One is the triangular impression and one is the quadrangular impression. This triangular impression for the scaphoid bone, and this quadrangular impression for the lunate bone, which form the wrist joint. Okay, so this is the external features of radius. The attachment of radius bone. This is the radial tuberosity. On the radial tuberosity, bicep brachii muscle is insertion. Insertion of bicep brachii muscle on radial tuberosity. This is the head of the radius. This head of radius is attached to capitulum of humerus and form the circumflex of the head, which are articulate with the radial notch of the ulnar bone and form a superior-radioulnar joint. This is the medial border, or also known as the interosseous border. This interosseous border which attach the interosseous membrane. On the lower end, this is the ulnar notch, and this ulnar notch is articulate with the head of ulna to form the infero-radioulnar joint. On the inferior surface of the lower end, this triangular part is attached with the scaphoid bone, and the quadrangular part is attached with the lunate bone. These are the carpals bone attached with the carpals bone, which form the wrist joint. Now come to the anterior surface. On the anterior surface, upper part of the anterior surface of radius, which are origin of flexor pollicis longus muscle. On the lower end of anterior part of the radius, which are insertion of pronator quadratus muscle. Pronator quadratus muscle is inserted on lower part of the anterior surface. And the anterior surface of lower end of the radius, where radial artery is palpated. On the posterior surface of radius, upper 2/3 part, where abductor pollicis longus muscle is origin. On the lower 1/3, extensor pollicis brevis muscle is origin. Originated on the posterior surface. Come to the lateral surface of the shaft. On upper part, supinator muscle is inserted. On the middle 1/3, pronator teres muscle is insertion of pronator teres muscle, and the lower 1/3 towards the styloid process, insertion of brachioradialis muscle. Is there. And the upper part of the radius, this is the oblique line. On the oblique line, flexor digitorum superficialis muscle is originated. Origin of flexor digitorum superficialis muscle. On the posterior surface of the lower end, this is the dorsal tubercle of Lister. Around this area, passing of the extensor compartment of muscle, so this form the extensor retinaculum, This is the attachment of the radius. Now come to the ossification of radius bone. Radius bone ossify one primary center and two secondary center. One primary center for the shaft, which are appear 8 week of intrauterine life. One for the upper end, that is the secondary center. This one secondary centers of the upper end, which are appear 4 years of life and fuse with the 18 years of the life to the shaft. This is the lower end. For the lower end, one primary center is there, which are appear 1 year of life and fuse with the 20 years of life to the shaft of radius. This is the ossification, one primary center and the two secondary centers for the of the radius. Radius is commonly fractured 2 cm above the lower end. 2 cm above the lower end. Distal fragments which are displaced downward and backward. Displaced downward and backward. So this fracture is known as the Colles fractures. This fracture is known as the Colles fracture. If fragments of the fracture is displaced anteriorly, then this condition is known as the Smith fractures. A condition where subluxation of head of radius is done, and this condition is known as the pull elbow, and this is most common in case of children. So pull elbow is most common in case of children. This is all about the radius bone. Thank you very much for watching this video.